This is the only supplement in the world every single kidney disease patient should be taking every day if they want to avoid dialysis. Gathering here today, we are going to see the best thing for your kidneys you can find on the grocery store shelves. This is a miracle remedy. When you mix 1/3 tablespoon in water and drink it, 3 things are going to happen in your body. First of all, your blood will become less acidic. Keeping the acid-alkaline balance in the body is a task that puts a huge amount of stress on the kidneys. This remedy will help them. Second, your serum potassium levels will decrease. Research is showing that if you have too much acidity in your body, your potassium will be higher. This remedy will help. Third thing that will happen in your body, your creatinine levels will decrease and your kidney function will improve. This is proven by studies that confirm the benefits of this miracle remedy even in stage 4 CKD patients.
Wow!
The miracle remedy I'm talking about is baking soda or sodium bicarbonate. Yes, this is a remedy every single kidney disease patient should consider taking because it can significantly delay dialysis. Guys, baking soda also comes with a warning. Don't take baking soda without watching the entire video. I will explain exactly who will improve their kidney health using baking soda and who should completely avoid it. So watch the entire video. Another thing not many people know about baking soda. If your doctor prescribes you baking soda, you don't need to go to the pharmacy and buy expensive and hard to find sodium bicarbonate tablets. The baking soda supermarkets sell is 100% pure sodium bicarbonate and it's safe to consume. You just need to know the exact dose, and today I'm going to show you exactly how to do that. So today we are going to see some easy tips to help you using baking soda to repair your kidneys. First of all, can baking soda really make you avoid kidney dialysis? In studies on CKD stage 4 patients, those that took baking soda were able to delay dialysis significantly. And these results are astonishing because baking soda is a very safe remedy with no serious side effects nor interactions with medications. This is why current guidelines state that patients in stage 4 and 5 of chronic kidney disease should take baking soda. This means that your doctor is supposed to prescribe this remedy to you if you have chronic kidney disease. Another question. Can people in stage 3 of CKD take baking soda? It depends on your CO2 levels or serum bicarbonate. The reason why baking soda helps so much is a condition called metabolic acidosis. Remember that one of the most important jobs of the kidneys is to keep acidity-alkalinity in balance. In people with kidney disease, this balance is often compromised and this causes acid to build up. This will in turn cause fatigue, headaches, fast heartbeat, nausea, and loss of appetite, but also bone loss, endocrine disorders, and muscle loss. Yes, it's a serious complication of kidney disease. Even more worryingly, having too much acidity seriously damages the kidneys. Baking soda can prevent all this. As I was saying, there's one thing you should absolutely know before taking this remedy. This is very important also for the dosage. Don't skip this part. Not every single kidney disease patient has metabolic acidosis. If you don't have this condition, baking soda will not help you. How to tell if you have metabolic acidosis? You need to do the CO2 blood test or serum bicarbonate level test. This test should be done regularly by kidney patients as a part of the Basic Metabolic Panel, BPM. But this is not always the case, so talk to your doctor and be sure that you're being tested for CO2. The normal range for CO2 is 23 to 29 milliequivalent units per liter of blood. In case you are out of the range, meaning that your level is 22 or below, it means you need baking soda. So if you have 22 or less in the CO2 test, take baking soda as directed by your doctor. 1 gram 3 times per day with water is a common dosage, but your doctor can give you a smaller dose or a bigger one, depending on your CO2 levels. 1 gram is about the tip of a tablespoon. This dose is not supposed to give you any stomach issue, but it's still better to take it on an empty stomach. Still, some people are too sensitive to this remedy and they will have stomach discomfort. If this happens, don't worry, you can still take baking soda under your tongue. This is the sublingual route. For sublingual administration, you just need to place the correct quantity of baking soda under your tongue and wait for it to dissolve. Again, consult your doctor to see if this is safe for you. Now guys, baking soda is amazing, but did you know that there is one remedy that can lower your creatinine level by 13.2% even in stage 4 in just 1 month? More about this in my video up here. And this is all for today. Thank you for watching.